So, good afternoon and welcome back again in this wonderful event, the Gulf Intervention Society Roundtable Discussion, year 2025 sessions. I do have the pleasure here to have two of the pioneers in cardiology in the Kingdom of Saudi Arabia. And our talk today will be focusing about cardiology fellowship training program and the evolution and the journey that happened in Saudi Arabia. So, my pleasure to introduce Dr. Khalid Al-Nimr, a well-known interventional cardiologist. He's also a social media influencer who is very well known in the Gulf region. Dr. Faisal Al-Goufi, an interventional cardiologist from Johns Hopkins Aramco Healthcare. Welcome to the GIS, and it's really my pleasure to be with both of you. So as we are all aware, cardiology fellowship training, Saudi Arabia was the leading in this field. Actually, the training started in the very early 80s with King Saud University Fellowship and also King Faisal Specialty Hospital. They started their own program. Till later in the late 90s, the Saudi Commission came and took over and they established the Cardiology Saudi Board of Cardiology. And I'm proud to be a product of that program, and also proud that Dr. Khalid Al-Nimr, during my training, he supervised part of my training.
Pleasure.
The program is expanding, and now in all the provinces of Saudi Arabia, the more programs are getting opened, and per year now, the graduates, they exceeded 80 to 90 graduates per year. So, Dr. Khalid Al-Nimr, can you tell us your story with Cardiology Fellowship Training Program in Saudi Arabia, and this journey?
As you mentioned, around 20 years ago or so, it was very primitive programs separated from each other. But after the Saudi Council came in, it united and became more standardized. And during the many years ago, there was advancement in the training and expansion of the numbers of the centers of training in Saudi Arabia. As you know, Saudi Arabia is a huge area. We need more and more training centers and more of cardiologists who serve the community and serve also the people who visit Saudi Arabia. We need programs which is highly qualified, produce highly qualified people. And we cannot reach this situation unless we unify the training protocols between these programs. So we unify the skills acquired, and we unify also the parameters we assist the trainee on. One important thing, I have seen it recently in the training programs, which is introduction of the live cases and simulation training. Simulation, as you know, in the whole world now, it's getting more and more, increasing the skills, avoiding mistakes, and increasing the skills of the professional people on the procedures. I think we need more involvement of the simulation machines in the training program in Saudi Arabia. The last thing I had on the programs is we need to encourage our fellows in the training programs to be more involved in research. The research, they need funds, they need facilitation how to do the research, and we need to do our own RCTs and our own trials, which can we help the local people and the people around the world.
Okay, that's wonderful. So you see, as I understand that we need funding, we need to establish a well-structured research programs, okay, that involves the cardiology fellows around the kingdom. So how do you see the collaboration between the centers? Because now, as you said, there was some fragmentation, that if we want to call it, that different program with different sets. Although the Saudi Commission and the Cardiology Fellowship Training Committee, they are on top of that to monitor that everybody is following the same syllabus and getting the same rotations, and they qualify, as do they have the promotion exam that goes from year to year. But do you see any initiative that can help with collaboration, so combining all programs together, like setting up, for example, the simulation, as you said, or, for example, setting up sessions that collaborate between the centers?
I think this is under the power of the umbrella of the Saudi the Saudi what is called association, الهيئة السعودية للتخصصات الصحية.
Saudi Commission for Health
Saudi
Specialties.
Commission for Health Specialties. This organization is responsible for making the plans of the organization of the different centers of training in Saudi Arabia and standardized where the collaboration will be. And I think they will be able to do it. I think we started slowly and a small piece, but we need to go fast because we need more and more training because we are opening more and more centers.
Okay, so Dr. Faisal, now in Johns Hopkins Aramco Healthcare, you started already a program, and this is the second year. So, and the program is growing. So, how do you see this program dynamics going on, and where do you see it going on in the future?
Great question. For any centers, when they start to receive trainee, first of all, I think the process, which you were part of it and the center was part of it, is to ensure the training requirements for each candidate is available in the center, and if those requirement is not available, then to facilitate for such trainee the ability to do the elective in centers where they can provide this additional training. I think it is a fact that the cardiovascular disease in general in Saudi is in the rise, and in order for us to keep with the Vision 2030 to expand the longevity of the Saudi national, we need to invest heavily in training program. To limit those programs only to public health center is not going to be fitting with the general vision of the Saudi 2030. I think, for example, I give the example of the training program within JAHA. We definitely considerably considered a medium-sized program in terms of the exposure for the fellow. But what we notice is also in providing a structured environment for the training can bridge the gap that the fellow or the trainee will miss from being trained in a bigger volume center. As Dr. Khalid elaborated to, simulation can be one, but another part is structural, dedicated responsibility to that fellow to advance him at an earlier stage, to include or increase the responsibility level, and that, in my mind, is a strategy that all medium to small size program can invest on. We cannot, the volume of candidate has to increase. The other aspect of the training program in our center is the funding. There gotta be a strategy nationwide to ensure that funding model also can expand to centers that have a private nature, so long that those centers ensure that the training requirements set by the Saudi Council is met, and the graduates of such programs can compete at any level within the employment. So I think funding is a major concern that I foresee and risk for program that currently in the private sector.
So these sessions will be broadcasted, and hope the stakeholders will all get into this idea and provide the necessary funding to as for this initiative, and also as what we mentioned earlier about having the simulation centers and getting all the collaborations together. So these are very good initiatives that we hope that all the stakeholders here that would listen to this and really provide the training, because we are now leading the training not only in cardiology, in many subspecialties in medicine in the Gulf region, and also there are many programs now which are considered joint programs, okay, that are done between the Gulf countries. So they get part of the training in Saudi Arabia and part of the training in Bahrain, and also in other programs that are happening also here in the UAE as well. So as a final remark, so what would be your advice to your fellows?
I think my advice to fellows is be ready. We need you. The future is very bright. We need more and more of you, and we have a lot of plenty of diversity of cardiac patients. We need all specialty of cardiology, and you are the people who expected to serve the community and the country. And we are eager to see you standing in front of us and leading the way.
Thank you for that. Dr. Faisal, we need a final word to the program directors.
I think to myself and to you as a program director and to all the program directors, the training model should include advances in artificial intelligence. We should train and equip our new fellows to be ready for the markets. More importantly, ensuring the competency training and ensuring that if the center or the training does not provide the fellow with the competency, to make sure for the fellows to be vocal about it so we can bridge that gap. So when we graduate them ready to be serving in the community.
Yes, that's very wonderful. Thank you very much.
Thank you
for your time and effort.
You.
And it's really pleasure to have these two icons here with me. And I hope you enjoy your stay here in Dubai as well.
Thank you.
Thank you very much, and thank you for your time and effort.
Thank you.
Thank you.